Good day, my dear postgraduate students. Welcome to the topics on health and disease. And the one that is chosen for the day is apoptosis. I hope you people appreciate how imperceptibly this topic blends with the background behind. Always think of the subheadings. The subheadings will take you to the answer. And in each topic, I choose the subheadings that are fit for that particular topic. Hence, make it a practice to rehearse them. Introduction. Always you find that this topic of apoptosis, it cuts across panels, many subjects, many disciplines, and even treatment. As you are seeing over here, it can be systemic, it can be immunological, it can be infective, it can be therapeutic, or it can be a damage to the cell. Also, microbiology plays an important role in this. We must also remember that there are dysfunctional and damaged cells which must be removed. It is a beautiful sentence that is over here. If you and I were to stay alive, the cells in our body must die. A superb quote which you people must remember. In order for us to stay alive, the cells in our body must die. The damaged or the dysfunctional cells must be removed. When not, the consequences can be disastrous. This is definitely worth remembering. The definition. Definitions are definitions. No own words, please. A solution is a homogeneous mixture of the solvent and solute whose composition can vary continuously within certain limits. So also over here, apoptosis is a form of programmed cell death that occurs in multicellular organisms. Look at the emphasis on it. Obviously, it cannot occur in a unicellular organism. And there are many biochemical events that can lead to the changes in the morphology, eventually leading to death. And there have been further developments on this. Also called as programmed cell death, it allows the cell to self-destruct or destroy itself when stimulated by the appropriate trigger. This again is wonderful, maybe one step further than the original definition. I would like you people to kindly by heart these, keep in one corner of your mind. The history behind. So, the development of the human being, or for that matter, any organism from a fertilized egg, is just not a linear process. It is not multiplication alone. You find that whatever is unwanted is being periodically removed, and the rest of it is being given a shape to which it develops. This is the classical example, the tadpole and the frog. You find that there is a tail of it which disappears, and in between the legs or the digits of the toes, you find that there is a web that develops. One disappears, one appears. There have been a lot of people who have contributed to this, and one such person is Kerr of Australia. I was inquisitive in choosing this particular picture because he had won the Paul Ehrlich and Ludwig Darmstaedter Award in 2000. And these are the other people, Willy and Curie. In 1972, the Greek word falling off was chosen as an apt description for this. And in 2002, the Nobel Prize was awarded to these people. So it has been to these three people. He is Berner, then Robert Horwitz, and John Sulston. This is John Sulston whom we are seeing. Probably I think I envy his picture a lot compared to the background picture of mine that you are seeing in a colored photograph. Obviously, he appears to be having more within his head and also outside. He shared the Nobel Prize in Physiology for this work in 2000. There are also alternate titles for apoptosis, which can be programmed cell death, programmed death, and programmed life termination. Wonderful things. Concepts are these. So, if you go to the net and to the other references, there will be multitude of topics which can be available for your references if time permits. Hepatitis. So, this is the case of a viral hepatitis wherein I am finding an apoptotic body. And this is eventually being engulfed by another cell. So, this particular arrangement is the cell membrane here is still intact. It is being engulfed by another so that it is being scavenged or removed without any spillover. Therefore, there is no damage or inflammatory reaction in apoptosis. And this is terminal deoxyribosyl transferase mediated DUTP labeling state in ISC, which demonstrates it. The role of apoptosis in HIV, CD4 cells. So you find that there is the CD4 cells which are here, and there is the various, the receptor and the ligand binding, etc. And they will be triggering the various pathways which will be explained. As a result of which you find that there is a death of cells. That is why you find that there is a decrease in the helper cells and the increase in the cytotoxic T cells in a case of HIV. And please do remember councilman bodies, yellow fever. Whenever we are asked about the councilman bodies, our mind goes to hepatitis, viral hepatitis. But then yellow fever is the prototype of it, in which again I am finding a eosinophilic, well circumscribed cell, and that is eventually being targeted by another inflammatory cell. It is being engulfed without any spillover or inflammatory reaction. In medicine, you find that manipulating apoptosis is challenging and vexing. Very beautiful sentence, because it can be used for a prevention, it can be used for a treatment, and if not allowed, it can progress on to a malignancy or to infections. So the suppression of apoptosis can lead to progression to cancer due to the survival of the tumor cells. And if you do study the abnormal cells as such, it can promote the treatment of them. Maybe something like a targeted therapy that we people are now talking about. Targeting the cancer cells, targeting even the infected cells. And all this mimics some kind of a physiological apoptosis. And when you do inhibit apoptosis, you can limit the ischemia in myocardial infarction. Neural ischemia, there is a role. Selective control of apoptosis can improve the immune system with relation to HIV or AIDS. And further study on controlling and executing apoptosis is always on, both in the diagnostic, microbiological, pharmaceutical, and in chemotherapeutic sectors. The mitochondrial theory, there is one related to mitochondria and another is external to the mitochondria. Let us see what is happening in mitochondria. This particular picture can be a little out of order, but then it is worth. So this is the mitochondria over here. I am able to see the cristae over here. And then there are the mutant mitochondrial proteins. There can be the damaged mitochondrial proteins. In a way, both of them mean the same. One is mutation and another is damage. And they will be leading to the activation of the and the production of the free radicals. Free radicals are substances which will be containing unpaired electrons in the outermost orbit. As a result of which, they will be leading on to error-prone DNA. and there will always be a defect in the DNA repair, as a result of which there can be a cell death. Also, there can be the activation of the oxygen species, so which can lead to a nuclear DNA damage and apoptosis, or the DNA mutation itself can lead to apoptosis, and this might be one of the features of aging. Aging is another topic. I shall come to it at a later date. So this is one thing that is quite simple, a line diagram which you can remember or even draw in your exam. This is another friend of ours. Always we look at histological pictures and confuse ourselves. And in the hematoxylin and eosin stains that we do without differentiation, these civet bodies appear more blue than pink. So I am finding them here at the basal layer of the keratinocytes. There will be the picture behind it, and there is the cyclooxygenase markers which are there, which have been used to identify them and to use them as treatment. And whenever there is a release of this, there can be the multiple cells and the mediators which can be released along. So this is one. I would like you people to kindly have this in mind, lichen planus and the civet bodies. The role of apoptosis, as we had mentioned earlier, can be to remove the cancer cells, to remove the infected cells, cells which are no longer required by the body, and cells producing antibodies also can be removed in an immunological treatment. The suppression of apoptosis will lead to an increased survival of the tumor cells, and selective control can lead to the treatment of either HIV, where the CD4 cells, helper cells, and in diabetes, where the islet cells can be preserved. Cancer suppression, cancer progression, anti-cancer therapy are all revolving around apoptosis. Now, for this, there can be an external stimuli, and whenever a nutrient is being removed, and then the toxins, hormones, other stimuli have got a role to play. So this is again a nice list for us to have. This is our age-old friend, the classical difference between apoptosis and necrosis. Thanks to Robbins. So this will be the picture that you people shall be having in mind. In apoptosis, you find that there is a cell shrinkage, and then there will be an amoeba-like extensions of the cytoplasmic membrane, in which there is a break of the organelles, and even the nucleus can be caught. And each of these fragments gets separated with an intact membrane around it, forming an apoptotic body. And finally, it is being engulfed and lysed without any spillover. So this is a comparative one. Until here, it appears almost similar to me. There is a swelling, there is an extension, etc. Whereas here there is a shrinkage, fine. But it is reversible. But here it is not reversible as such. But then once there is a death of cells, it is usually a group of cells which are affected. There will be an inflammatory reaction, there will be lysis of the groups of cells, spillover of the lysosomal enzymes, the damage, etc. Go back to your topic on necrosis, you can read them. And look at this picture. It appears seemingly very simple, and we can retain. It is a thymus. We no longer have a thymus in us. It has got involuted or disappeared. So you find that there are some steps in it. There is an entry of the T cell precursors, the proliferation. There can be a cell death and an exit of this. This usually happens. But there can be an involution when there is a decrease in the number of the precursor cells or the entry of the cells. And there is a lower capacity for the cells to proliferate within the thymus. There is an increased amount of thymocyte death or a decreased amount of exit. So any of these things, when there is going to be an increased amount of death or an exit, you find gradually the thymus becomes smaller and smaller. It undergoes an involution. It is supposed to be an embryological development. There are the T cells from the thymus, B cells from the bursa of Fabricius. And these are the features. We have already mentioned it. Again, you people can go through. It is very simple. There can be a blebbing of the cytoplasmic membrane, shrinkage of the cell as well as the nucleus, fragmentation, condensation of the chromatin, and there can be a decay of the messenger RNA. And you find that billions of our cells are dying each day. So this is being finally engulfed by a phagocytic cell, the apoptotic body. This is another beautiful diagram, and the features continue. Shrinkage, rounding, retraction of the lamellopodium. Dense cytoplasm, the organelles become more and more packed within a smaller territory. There can be karyorrhexes, and the endonucleases fragment the DNA, and the products are very quickly removed. It is as though there is a first state that is happening. And look at these are all apoptotic bodies. All need not be containing all the representatives. And there can be some apoptotic bodies even without nuclear remnants. And this is the difference. I would like you people to kindly read it. So it is again a UG question, seemingly UG question. And to my perception, there is no difference between a UG question and a PG question. I'll come to that tomorrow. And what are the methods of distinction or identifying apoptosis? This I would like you people to kindly by heart. There can be a live cell imaging. They take an image of the entire cell being fragmented and phagocytosed. Time-lapse microscopy. After a sequential period, they find the disappearance of the cell. Flow cytometry is one. Fluorocytometry is another one. Transmission electron microscopy. Cellular markers for DNA fragmentation. And cytochemistry, Western blotting. So this is a beautiful list which I would like you people to prepare, mug up, put it in a box and write in your exam. This we had already seen. Now, coming to the mechanism of apoptosis, there can be a caspase dependent mechanism and the caspase independent mechanism. For the time being, I'll concentrate on the caspase independent mechanism. There are two things which he had given. AIF, apoptosis inducing factor, and endo-G, which means endonuclease G. This is caspase independent. And what is caspase dependent? There can be an extrinsic pathway and an intrinsic pathway. Intrinsic pathway, incidentally, is the mitochondrial pathway, which we had seen earlier. So I think people will be able to write all this. This is a beautiful, again, flow diagram, which will be useful for us. Now, this diagram shall be the fulcrum of our answer. This is the cell membrane. There can be an extrinsic pathway and an intrinsic pathway. Extrinsic pathway is there are some receptors at the cell surface which receive these ligands and lead to the production of procaspase, which can activate the caspases. As a result of which you get activated caspase 8. There is an effector caspase that is being formed, which can lead to apoptosis on its own. Or it can lead to the production of BH3 only molecules and activate the backs and the back. These are supposed to be pro-apoptotic, which can be prevented by anti-apoptotic BCL2. These act on the mitochondria, stimulate the mitochondrial pathway, cytochrome C, APAF1 and caspase 9. Again, they will be leading to effector caspases and apoptosis. So this particular diagram, I would like you people to. Now, there are some abbreviations which might be difficult for us. So what happens is, these are the factors and TNF factor is a major cytokine. R.A.T has been mentioned as the tumor necrosis factor associated death domain. FAT has been mentioned over here, which can be fast associated death domain. And DISC over here is death inducing signal pathway. At least these, if you people write, definitely you will be scoring more. In fact, I'll bet that this will be the best slide of my presentation. If not this, so there is an extrinsic pathway and the intrinsic pathway. There are the receptors, FAS over here, FAD, activation of the caspase, caspase 3, and effector caspases are there. Finally, there is a death of the cell. So this can be intrinsic, leading to the activation of the mitochondria, damage to it, and caspase 9 is being produced. Again, there can be apoptosis. This is also a simple diagram. Any of these you people must draw. Now, what is the role of apoptosis in tumors? There are some pro-tumor pathways, which include the survival of the growth, the anti-tumor immunity, angiogenesis, remodeling, and metastasis. So whenever there is a cell birth and leading on to a cell death ultimately, in between there can be the proliferation of the cells, and then there is a TAM activation signature or a TAM accumulation, as a result of which you find that all these activities can happen. So this is important for us in analyzing the progression of the tumors or in deciding the anti-cancer therapy. So this again is an important, very simplistic diagram from Encyclopedia Britannica. What are the extrinsic factors? It can be a nutrient loss, X-rays, heat, hormones, irradiations, etc. And these activate the BCL2, which lead to the implication on the mitochondria. Finally, there is an apoptosis that is carried. Or it can be from within the cell. There are malformed proteins signaling malfunction. Again, BCL2 can be activated, leading to the DNA damage, or from the DNA itself, there can be the BCL which can be activated, as a result of which again the apoptosis is being executed. And these are being engulfed by the scavenger cells. Very simple diagram for us to have in mind. Physiologically, there can be apoptosis during embryogenesis, which means there can be the menstrual cycle, for example, the menopause. It's a classical example of apoptosis. Separation of the digits, again, can be apoptosis. Loss of proliferation cells, such as involution of the thymus, atrophy of the bone marrow, all are there. In fact, any form of atrophy can be a physiological apoptosis. Elimination of the self-reactive lymphocytes and elimination of the whole cells that have served the purpose. Why does the RBC stay for only 120 days? This over here, there can be a maternal transcript and then there can be an embryonic genomic activation. And look at this chain that is happening over here. There is apoptosis and then there can be senescence. There can be apoptosis again. All these are because of the various changes that are over here. BAX, the caspase, 8, 3 and 9, the DNA fragmentation. Or there can be the shortening of the telomeres, active metabolism, increase in the reactive oxygen species, which can again lead to this. A very, again, simplistic picture. Always pictures I like very much because they will remain in our minds. And listen to my voice and you will be registering them. Some cells of my heart get necrosed initially, but remainings are now willing for an irreversible programmed cell death. Wonderful. It's a wonderful saying that this person has written. After I think it's from our country, Prakash Upadhyay. It is a beautiful apoptotic shedding. This is one of the references from which I'll be continuing. What are the pathological conditions? As I had mentioned, it can be these: the DNA damage, radiation, chemotherapeutic drugs, extremes of temperature, hypoxia, accumulation of misfolded proteins. See how gradually the answer becomes more difficult. Infections, which will be viral, pathological atrophy after a duct obstruction. And two extremes also he has mentioned. One is inadequate removal of a substance, which leads to a fatty liver. The R is missing here. And the failure to degrade a metabolite, which can lead to storage disorders. So these are certain pathological conditions which we shall again have in mind. So courtesy is National Toxicology Programs. And this is the pancreas in which there is a cell that is undergoing a cell death. There is a fragmentation that is seen. This particular table is important for us to by heart again. There are apoptotic genes, there are anti-apoptotic genes. Apoptotic genes are the BAX and the BAC genes, whereas BCL2 gene is the anti-apoptotic gene. Anti-apoptotic genes, it maintains the mitochondrial integrity and it prevents the leakage of the protein C. So therefore, it prevents any cellular damage. Whereas the BAX and the BAC, they will be activated by damage to the DNA. They are misfolded proteins and they happen in viral infections. Also, the protein product can leak through the channels of the mitochondria and of the protein cytochrome C. Therefore, they will be leading to the damage and the death of the cell. So this is supposed to be destructive, this is supposed to be protective. Kindly by heart this particular one. It is again another kind of a summary. So we have been mentioning the ground glass appearance of the nucleus, and the cell itself you find it is opaque. What is the meaning of the ground glass? You will not be able to see through it. Sometimes in windows it allows light to come through, but you cannot see what is on the other side. That is ground glass. It has got that kind of an appearance and it occurs in hepatitis B. And this is our civet body which you had seen in lichen planus. This is a wonderful work that has been done by this person. This particular reference over here, I would like you people to visit similar articles. What are the stages in the mammary gland development? So this is a gland as such. There is a basement membrane and these are the various things. It will be secreting the milk globules and it is being constantly shed. Therefore, there will be the apoptotic bodies that are being formed. And there can also be the activation of the death receptors. So you find that there can be a programmed death of cell by cell. The adipocyte is shown outside and these are all the dying cells. Without any nucleus or anything, he has shown it over here. And this is the cytokine receptor. So progressively you find that this is an intact gland, very few cells are dying, then progressively more and more cells are dying, they all form apoptotic bodies and they are being enveloped. Finally, you get an atrophic or an involuted breast. This is again an example that you people can write and apply to any other organ. So what are these? I would like you people to kindly identify and explain. So this is something called as syndactyly. It can be an embryological malformation. It is there during embryogenesis in all of us. But gradually you find this area becomes involuted. You get separation of the digits. And similarly, this is a tadpole. This is supposed to be a total vegetarian. And there will be the loss of this tail. You don't find a tail in this. And instead you find there are no webbing over here. These will be developing in this region. How beautifully it is being programmed, I do not. And incidentally, this fellow is supposed to be a omnivorous or even a carnivorous one, eating the insects and other creatures. And this is one instance of a cleft palate. So these are the things. The Count-Sedman body we had mentioned earlier. What are the implications in disease? There can be defective pathways. There can be X-linked inhibitor of apoptosis protein. There can be a change in the transcriptional regulation. Also, there can be dysregulation of P53, the growth factor. Inhibition of apoptosis can lead to cancer. And you find in the cycle regulating the P53 interfered, it can lead to cancer as such. HeLa cells are being activated in retinoblastoma. And in treatment, by increasing the susceptibility of the apoptotic cells in the diseased organ. So this particular one in implications, you people will score if you read. This is another Final diagram, I would like you people to practice it yourself and make yourself perfect. So there is a cellular stress within the cell. What happens? Externally, there are the receptors over here. What happens? There is an activation of the caspase over here and another caspase. Finally, they all lead to apoptosis. I would like you people to kindly practice it yourself on the screen. The conclusion and perspective. It can be deregulated, increased or decreased, and destruction or accumulation of the cells can happen. Molecular mechanisms are involved in apoptosis. The apoptotic pathway can be modified for clinical benefit, and it can be the cellular or molecular target in any form of therapy. And there can also be a physiological assessment of the cell survival, measurement of the therapeutic efficacy, and preventing the cardiac myocyte from activating the caspase, which can lead to ischemia. A functionally inert cell can be dangerous. That is why they are being constantly shed from your body so that the others could be adopted and your body could develop. Also, you find a lot of therapeutic knowledge nowadays is being obtained, thrown into force, and put in practice. These are again some of the back references. One of the main reference can be from Wikipedia itself. We need not shy. You find volumes of material have been crept into, and I'm very humble to just give you only 5 of the references again from. They are called back references. You go to a particular article, go back behind, and then you choose an article from it. They are called the back references. One of the important references can be Wikipedia. You find that there are volumes from all over that have been thrown into it, beautifully compiled, which I cannot claim to be mine. Neither is Wikipedia claiming so. He has quoted enormous number of references which you people shall visit, and it is worth. Who knows, tomorrow one of you can be in line for the Nobel Prize also. The references are too many. I have just chosen a few of them. Kindly go back to any of these if time permits. The most painful goodbyes are the ones that are never said and never explained. Thank you for your patient listening.